As we turn our attention back to the Trump transition, we have spoken several times with Joe Zepecki as he does work for Protect Our Care at the state level. At the national level, Protect Our Care Executive Director Brad Woodhouse put out a note yesterday or the day before about some of Donald Trump's other selections for key healthcare leadership positions. All the attention has been on Robert Kennedy Jr., and there probably should be even more attention on him and his troubling stances. But he's not alone in this roster that Trump is putting together and its potential impact on public health. And so Brad Woodhouse from Protect Our Care joins us now. Brad, good morning. Thank you for being with us today.
Hey, good morning. Thank you for having me.
Yeah, so nice to see you. This is an interesting kind of development that you're pointing out, because you note that RFK Jr. and by the way, Dr. Oz, they deserve a lot of scrutiny, but let's not forget who else is out there. So let me just turn that over to you to just explain a couple of the other folks who might be flying under the radar, but that maybe people need to know about.
Well, so let me set the stage for this just a little bit before I get into some of those other names. I mean, let's associate all of this with Donald Trump.
Sure.
Donald Trump has never cared about the health care of the American people. He started his first term, hell-bent on repealing the Affordable Care Act. When he couldn't do that, he completely did everything he could to sabotage it. The Affordable Care Act was in a near crisis when Joe Biden came into office. He turned that around. Not to mention we were in a pandemic crisis. So we're from Trump, we got it from both sides. He went after healthcare coverage. He did nothing about healthcare costs, did nothing about prescription drugs, and then he intentionally, for his own political benefit, mismanaged the pandemic. And now he is hell bent on doing that all over again. And I can't even start this segment without saying that we have a war room. It's called the RFK War Room. You can imagine what it is. That is completely intended to defeat RFK Jr.'s nomination to be Secretary of Health and Human Services. We just think that he presents of all of the nominees, the most existential crisis. And existential's a real and potent word here. I mean, he went to Samoa, American Samoa, some years ago, spread a bunch of misinformation about the measles vaccine, and associated with his misinformation, 83 Samoans died. So if you extrapolate that type of disaster into what he could do at the bully pulpit of running the Department of Health and Human Services, we're out to defeat his nomination. We think they all should go down. We'd like to defeat the nomination of everybody that Donald Trump has nominated for healthcare, but because in some ways it's almost like he's just simply trolling. Like you think you want good healthcare? Wait till you see, hold my beer, and then he's nominating people who are anathema. I mean, like the last thing that some of these people care about, whether it's RFK Jr. or Mehmet Oz or Dave Weldon, the last thing that they care about is providing, real health care to the American people. And look, they're grifters. I mean, that's. Can you just imagine? RFK Jr. right now is selling merch about his nomination. He and his wife were, I don't know, showering nude or whatever, and selling some type of stuff over the weekend. So these are really scary people. But we have Marty Makary for Food and Drug Administration, and here's someone who, all roads to some extent lead to Donald Trump, but all roads also lead to RFK Jr. I mean, I think Marty Makary's most notable thing is that he supports RFK Jr.'s bogus science claims, and he wants to overhaul, the Food and Drug Administration. The Food and Drug Administration, I mean, if there's any organization in the United States of America that should not be politicized, I mean, it's the Food and Drug Administration. I understand there are a lot of powerful interests, there are agricultural, interests. There's, the whole food industry. Then they're obviously, advocates for, for good nutrition. So there is a lot of politics in it, but at the end of the day, it should be led by science. And Marty McCarty was the last person that will lead with science.
It should be, but again, whether it's the FDA or the EPA, not only do you have these troubling nominees, but now you have a U.S. Supreme Court that is looking at these agencies and saying, well, maybe you don't actually have the authority that you thought that you did. And so it's already like these nominees have waiting accomplices over in the judicial branch to strike down whatever was done prior to Trump's election that they don't like.
Well, that's absolutely right. I mean, and these, to the extent that the largely Trump appointed Supreme Court wants to roll back the administrative state, these folks, they'll just roll over for that, because they don't have plans to do things. They have plans to stop things. They have plans to roll back things. They have plans to inject skepticism about science, about infectious diseases, about vaccines, into the public domain, really for no other reason than they think they're all a bunch of pseudoscientists and grifters. And look, I believe that RFK Jr., he was an environmental lawyer. He probably has did some things that even people on our side would believe were good back in the day when he was, fighting the fight on the environment. But I believe that he came to vaccine skepticism, partly because of grifting. I mean, this has been a thing he was making. I saw somewhere $20,000 a week with the group that he was running or associated with before he started running for president. $20,000 a week with a group that is filing, bogus lawsuits about vaccines, that is spreading vaccine, disinformation. And so none of these people are coming to this. Look, in the last administration, we had people running HHS. We had people running the Center for Medicare and Medicaid, which Mim and Oz has been nominated to, that we disagreed with on policy. But they were professionals. I mean, maybe not the type of professionals we would put in. The first or the second, I guess, HHS secretary had been a pharma executive. The head of CMS had been a healthcare person under Pence in Indiana, had led, I think, his Department of Health. So, so those were people that had some credentials. We disagree with their policies. These people have no credentials.
It gets back to that. It gets back to that whole notion of what we actually want to get back to, believe it or not, in this country, are honest disagreements. Rooted in a shared set of facts, and that's what's lacking when you put people in who are just engaged in marketing and quackery. So it's part of a conversation we're going to continue here with Brad Woodhouse in just a moment. First, a quick note that tonight the Packers play at Detroit. You can catch the pregame starting at 5:00 on Civic media stations in Racine, Kenosha, Richland Center, and Park Falls. And of course, we'll be talking about it tomorrow morning here on Up North News Radio. We'll continue our conversation with Brad Woodhouse in just a bit. I'm Pat Kreitlow. You're Up North.
I'm out the door. It's like you've gone.
Okay, we didn't get that much snow, but since it's Walt Disney's birthday, we thought we'd throw a little something out there toward him on Up North News Radio at 7:21. The publisher of the LA Times now wants to personally review headlines. And Mika Brzezinski is now apologizing on air for mild criticism of Fox News. Those are just two of the topics we'll talk to Mark Jacob about in less than 15 minutes. But now we're going to continue our conversation with Brad Woodhouse from Protect Our Care about the interesting nominee choices by President-elect Trump in all kinds of areas that would affect our public health, our ability to ward off a pandemic. We got into the person that would head up the FDA. You briefly mentioned Dave Weldon, who would set up the Centers for Disease Control and Prevention, and he is the former Republican member of Congress from Florida. That in itself should probably be disqualifying, but it also, his thinking on things like the pandemic, I guess we're no strangers to here since we have Ron Johnson here in Wisconsin, and imagine Ron Johnson running the CDC.
Oh my God! I mean, I can't even fathom. First of all, I want to think about, when we think about these nominations and we think about we're running this RFK war room to defeat his to defeat his nomination. To some extent, we want to think about, what could you say to a Republican senator if one would take my, if one would take my call? I think every Republican senator who is even remotely a possibility to vote against any of these nominees, and if they have children, I think probably most of them do, I bet they got them vaccinated.
Oh, of course.
And I bet they got them vaccinated. I bet some even probably got them vaccinated for COVID, but then get them vaccinated annually for the flu, got them vaccinated for measles and rubella and and polio. And I just want to think, if you were taking your child at that point in your life to the doctor's appointment to get them these vaccinations that will help guarantee that they don't contract these diseases, and you ran into Dave Weldon or RFK Jr. in the elevator and they said, don't do it. Don't do it. Don't vaccinate your child. I mean, you would think that person was a quack. You would get off on the very first floor you could and take the stairs up. I mean, that are the type of people that these Republican senators are getting ready to vote on. Look, I think RFK Jr. is existential. The head of HHS has such a bully pulpit, and remember, they're over immigration resettlement. They're over HHS. They're over CMS. They're over the Affordable Care Act, Medicare, Medicaid, CHIP, and all of this stuff about infectious diseases and research. But I will say Dave Weldon is equally scary, because the CDC, and in particular, once the advisory committees made recommendation, the CDC director is the person responsible providing guidance to the American people about vaccinations. I mean, remember how often we were waiting throughout the course of coronavirus pandemic, and then even after Biden came into office, about what are the instructions? What do we need to do? What do we need to do for our children? When do we need to get in line? How many times do we need to get stuck? Which one of the variety of vaccines should we take, depending on who we are and what our pre-existing conditions are? That's what the CD, and you've got a vaccine denier in Dave Weldon, and a vaccine denier, skeptic. By the way, Pat, we should not call these folks vaccine skeptics, particularly RFK Jr.
Yeah.
He bragged about walking around telling parents not to vaccinate their kids. That's not a skeptic. That's not a skeptic.
No, if you're a denier, you're denying facts and science. That there's more here. There's the nominee for Surgeon General. There's the nominee to run the National Institutes of Health. There's the nominee to be the Deputy Secretary of Health and Human Services. And what you've got here are things that there's either ties to industry, or there's just talking heads on Fox News and other cable.
I mean, I think one of the through lines, and it doesn't apply to every single person that he has nominated, but RFK Jr., what is he? He's a celebrity. I mean, the only reason anyone knows about RFK Jr. is he was able to get even a little bit of attention when he started running for president as a Democrat, and then he switched to being an independent, and then he switched to supporting Trump, is because of his last name. Mehmet Oz, another celebrity, and the person that is now being nominated to be Attorney General has spent 5 years on Fox News as a talking head, and so
Hey, Brad. By the way, Wisconsin, Sean Duffy.
Yeah.
For transportation secretary, we're really aware of the path from reality TV to Washington D.C. and it literally hurts our heads. Alicia writes it on YouTube to say, "I physically shuddered at the thought of Ron Johnson heading the FDA would be an understatement, because we have seen this show here, and so we can express our amazement all day long that this happens, but I got to, in our short time left, I've got to take it to, where do we go from here? It's I hate to say it, it's clear that not all of these nominees are going to run into brick walls and go down in flames like a Matt Gaetz, but the opposite of that would be to just roll over and accept all of this. And I'm sure you're not advocating that folks do that either.
No, we can't do that. I mean, Pat, I will tell you, I think one of the things that Protect Our Care as an organization brings to the table is that we're not focused on just one single issue in healthcare or one single issue in public health. We're focused on the broad landscape, and we're focused on the politics. And so we are building a case right now for big elections in 2025 in Virginia, New Jersey. We're building a case right now on healthcare for the midterm elections in 2026. So we have to do this because we got to lay down a record. Healthcare has been one of the biggest issues in elections going back a dozen years or more. It was a top 5 issue in this last election, and people that voted on healthcare voted overwhelmingly for Democrats. I mean, Tammy Baldwin was a beneficiary of that. So we have got to lay down these tracks, and we've got to put public pressure on them. They will undermine public health. They will undermine healthcare if we're not vigilant and fighting these proposals, fighting this conspiracy theories, fighting this vaccine denialism every single day.
And that's just it. It has to be exposed, and it has to be, blocked as much as humanly possible. And don't just roll over and take it. Brad Woodhouse from Protect Our Care, protectourcare.org. Thank you so much for giving us so much of your time this morning. I hope we can check in again soon.
Pat, thank you so much.